style question, neural tube defects and folic acid deficiency. A 27-year-old pregnant woman comes to the clinic for a routine prenatal visit at 16 weeks gestation. She has had irregular prenatal care and did not take prenatal vitamins before or during the early stages of pregnancy. A maternal serum screening reveals elevated alpha-fetoprotein, AFP. A subsequent ultrasound shows a fetus with failure of the neural tube to close at the caudal end, resulting in herniation of the meninges and spinal cord through an open defect in the lumbosacral region. Which of the following best describes the mechanism responsible for this condition? A. Failure of mesodermal migration. B. Failure of neural crest cell migration. C. Failure of primary neurulation. D. Failure of secondary neurulation. E. Failure of apoptosis in the embryonic ectoderm. Answer: failure of primary neurulation. Explanation: neural tube defects, NTDs, occur due to failure of the neural tube to close properly during the 3rd-4th week of embryonic development. Primary neurulation involves the folding and closure of the neural plate to form the neural tube. Folic acid deficiency is a major cause of NTDs, as folate is crucial for DNA synthesis and methylation, which are essential for proper neural tube closure. This case describes myelomeningocele, a severe form of spina bifida, where both the spinal cord and meninges herniate through a vertebral defect. Why other choices are incorrect? A. Failure of mesodermal migration causes defects like gastroschisis and omphaloceal, not neural tube defects. B. Failure of neural crest cell migration leads to disorders like Hirschsprung disease, DeGeorge syndrome, and neurocrestopathies, not NTDs. D. Failure of secondary neurulation affects the caudal cell mass, leading to tethered cord syndrome, but does not cause open NTDs. E. Failure of apoptosis in the embryonic ectoderm can contribute to syndactyly, fusion of digits, but not neural tube defects. Clinical relevance: maternal AFP screening. AFP suggests NTDs except enclosed defects like spina bifida occulta. Prevention: folic acid supplementation 400 mesograms per day preconceptionally reduces the risk of NTDs. Other risk factors: maternal diabetes, obesity, anti-epileptic drugs, e.g. valproate, carbamazepine, genetic predisposition. Would you like another embryology or prenatal screening question?